So the posterior manip, you're going to lay with your leg all the way straight. And what I'm going to do is, can you slide back so your heel's on the table? So your stabilizer. Thanks. And then I'm going to put a towel underneath the backside of his knee so that when I push on him, I don't hyperextend his knee or push him into valgus. And if I want to get in the plane of this joint, if I take Sean's leg and give him a little bit of internal rotation at the hip, now when I come in here, I can come straight over the top. Okay? I'm going to have you move this way just a little bit so my angle's just a little bit. Then I can get a little bit even more over the top. Okay, so get him kind of close to the edge. I internally rotate his leg. Now my pre-manipulation hold here is as I'm pushing here, do you notice any irritation? Because I'm basically going to push his fibula back toward his common peroneal nerve. Okay, so if I just internally rotate, latch over it, and then I basically what I do is I sink into the naga height, and then at the end I thrust. Okay, so it's like thrust. Okay, so you take up the slack and thrust. So that's a posterior glide, anterior to posterior. So that would be somebody who maybe had a supination injury and came forward, got stuck forward. Okay. And then I would redo an asterisk, either something functional or do joint play again. So that's the anterior to posterior one. Okay. Now if I'm going to go the other way, I'm going to have you go into quadruped, and I'll treat the same leg. So what you're going to do is you're going to bring this leg forward so that you can kind of get out of my way a little bit. And then what I'm going to do is reach across. So now if I'm thinking about this going posterior to medial, anterior to lateral, if I stand on the inside, I can kind of basically just get on the back side of his fibula. I can get a big old wad of soft tissue, kind of pad your nerve, right? And then thrust anteriorly. So my line of force becomes posterior, medial to anterior lateral. Okay? So this one can be a little bit nervy because the peroneal nerve is right there. So again, my pre-manipulation hold is, Sean, as I'm here, resting on the backside of your fibula, does that bother down into your foot at all? Okay. You know, he takes a deep breath. I don't think it affects it that much, right? Okay. But I can feel, if I have my fingers in the front, I can feel your fibula move as I come forward. So I can get to the end of the barrier and then thrust. Okay, so those are relatively easy techniques to do. Okay, and the big thing is just adjusting the patient so that your thrust is pretty much straight down, or adjusting your line of force so that you have a straight elbow.